Which brings us, excuse me, to the sixth and final recommendation, which has to do with culture change, which is also a portion of the title of the report. I beg your pardon. As the committee had its conversations over the 6 to 9 month period, we returned many times to a discussion of personal experience and what we were finding in the literature about the way that this particular type of injury is viewed by athletes, by coaches, by parents, by administrators of sports. And even though, as Tracy said, there's an indication of increased willingness to report the experience of a concussion, there's still the sense that within many cultures, athletic cultures, there is the desire not to report on the part of the athlete. No, thanks, I've got some here. It's just not working. On the part of the athlete, not to report it because they feel like they're letting their teammates down. On the part of the coaches because it upsets the team that they have on the field, or their own belief that, I had these, I'm okay, this is just part of the sport. On the part of the parents who want to see their children excel and be accepted. There's this very subtle pressure that somehow, because this disease, because this injury is not visible, it's treated differently than an ACL tear. If an athlete on the field tears their ligament, you immediately get them off the field, you start treating them, you have rehabilitation. Nobody expects you to just wrap it and put them back in. But in some cases, that's what happens with concussion. We need to change that culture. And indeed, of the committee's recommendations, this is the recommendation that can go into effect for earliest. This is the recommendation that can happen first, with people saying, that is an injury, we're going to treat it seriously. And so our recommendation number 6 is that the NCAA and the National Federation of State High School Associations, in conjunction with the CDC and Health Resources and Services Administration, National Athletic Trainers Association, and the Department of Education, all together should develop and implement effective large-scale efforts to increase the knowledge about what a concussion actually is and change the culture of how concussions are viewed by all of the participants in sports, coaches, and parents, so that when a child in this age range suffers a concussion, people say, that's a significant event, we're going to take care of you, you're not going to go back to competition, you're not going to go back to school until we're sure that you have recovered. So that is the quick background of the report, the rationale behind each of our 6 recommendations, and for the remainder of the hour, we are open to any of the questions that any of you might have in the audience. Again, please go to the microphones. I'll try to recognize you one by one.